We'll now, as Kieran suggested, move to a presentation from Carys Thomas, and many of you know will know Carys as Head of Policy in the Research and Development Division in Welsh Government. And Carys is going to talk us through the new UK vision for clinical research that has recently been launched. So I'm hoping Carys is going to join me, and there we are.
Thank you, Nikki. Thank you, Pnawn da pawb. Good afternoon to everyone. Absolute pleasure to be here, and I'm really pleased to see the Sport and Delivery event back up and running. I've got about 20 slides, which I am going to sort of whiz through the next 15 minutes, but I've been asked to talk about a document that was launched quite recently called Saving and Improving Lives, the Future of UK Clinical Research Delivery. I'll refer to it as the vision document from our presentation. But I'm going to give you a quick overview and tell you what's happening next. So you'll see a load of logos on this slide, and the vision really is a work of a range of partners, and we kind of all got together and agreed that we needed a sort of a compelling public sort of vision that sort of convinces everyone of the value of clinical research. So I'm completely aware that today I'm completely talking to the absolute converted. So hopefully this document has been drafted with an audience in mind that kind of, the people that I'm referring to possibly are the sort of the busy sort of healthcare worker who doesn't feel empowered to do research as part of their role, or you've kind of got the busy sort of NHS leader who has competing demands and doesn't quite understand how clinical research can have an impact on clinical practice. And then clearly, obviously, you've got, the hopeful patients out there, their carers, their families, who don't sometimes always understand that they could be offered opportunities to be part of trials. And I suppose on the other end of the spectrum, we do have maybe the concerned taxpayer who may not understand the value of clinical research and the value that it brings to public health and why it should be a priority for government. As Kieran has sort of highlighted, the COVID pandemic, has really brought into sharp focus lots of things like the economic necessity of having a really strong sort of research culture underpinned by the NHS. So as you'll see on the slide, we've got some Welsh partners in there, and I know some of them are obviously speaking at the event over the next day or two as well. So working in partnership through a sort of common vision, it's sort of enabled us to focus on developing sort of an UK-wide cross-sector coordinated programme of work. So this is the work that's going to be done to help in delivering the vision. And I suppose the focus of the vision is really about the restoration of the clinical research activity that was underway pre-COVID. And again, referencing back to what things like Nikki and Kieran have said, it's about, learning lessons, building that more resilient clinical system moving forward, and clearly obviously wanting to expand the clinical research system. And we'll obviously want to keep our delivery of our commitments to the UK to be a leading global hub for life sciences. So the vision document was published just before we went into a pre-election period. It was signed off by the respective ministers who have got R&D in their portfolios across the 4 nations. And I think this is really important actually, because, it's even in Welsh Government, it's quite competitive in terms of what you put in front of ministers. And it was really exciting that we were able to have a quadrilateral meeting where the 4 ministers had the opportunity to talk about the vision document and also, spend some time themselves reflecting on the great research endeavour during the COVID pandemic. So that's good news for you and good news for us, really. So in terms of the implementation of the vision, I thought I'd just touch on this first before going into a bit more detail of what's in the vision. It's going to be implemented, I would say, probably in 2 phases. So there will be an implementation plan for the first phase that hopefully will be launched sometime perhaps late May. And the first phase is very much going to focus on what we're going to be doing in this forthcoming year. So it's consolidating a lot of the work that's been done over the last year and a half, and taking forward a number of service improvement projects in the clinical research delivery system. But it's really, once we've kind of consolidated, and we don't really kind of want to go backwards to things we were doing pre-COVID in a lot of our areas of work. Once we have consolidated our thinking there and we've moved forward, we're going to then focus on a sort of second phase where we want to set our sights really much higher and be a lot more sort of ambitious. And, you know, to be quite frank, this is going to come with a resource need, and Kieran and I and many others in Welsh Government will be putting a case forward so that we can secure additional funding for the clinical research system so we can support some new ambitious and bold projects moving forward. So the vision document itself is sort of centred around 5 key themes. And what I think I'll do next is probably just whiz you through these and then move on to some of the actions that will come out of them. So the first one is about embedding research in the NHS. And, you know, clearly we all already know that this is about creating a research positive culture to which all health and care staff feel empowered to support and participate in clinical research as part of their job. The second theme is about patient-centred research. And this is about, you know, making research accessible and that participation in research is as easy as possible for everyone across the UK, including those in sort of rural and sort of diverse and underserved populations. You know, and this kind of means sort of designing studies, you know, that makes it easier for people, less hospital visits, less GP visits, and better use of more sort of virtual delivery models. The third theme is around, you know, making the environment itself more streamlined, more efficient, being a lot more sort of innovative so that we can be seen as, you know, the go-to place in the world to do efficient and cutting-edge research. You know, this will help with our international competitiveness. And, you know, clearly we want to see some of the patients in the UK to be some of the first into global trials so that they get access to new treatments. And something I think is really important in order to modernise our clinical research environment is, you know, really advancing, having a sort of data-enabled clinical research environment, using our unique data assets, you know, to improve health and care for the patients across the UK. And last but not least, having a sustainable and supported workforce is absolutely critical. You know, we need to have the right capabilities, but make sure that we're offering rewarding opportunities and exciting careers for all healthcare and research staff across all professions. So the 5 themes are going to be implemented through sort of 7 areas of actions. And the areas of actions is what's going to be the foundations of the implementation plan that I just mentioned a little bit earlier. So what I'm going to just do next is canter through the types of things that are going to be in the 7 areas of actions, just to give you a bit of a feel. Now, a lot of this work is sort of under development. The implementation plan isn't quite drafted yet, and we're still kind of thinking about what needs to go in there. So I think hopefully what I'll share with you will give you just a bit of a sense of what's coming. So in terms of the first action, which is about improving the speed and efficiency of study setup, this is about expediting costings and contracts and approvals, you know, all the types of areas that often cause delay in progress. And you're going to hear the excellent work that Helen and Fiona have been doing in the event as well. So I'll let them explain more about that. But there's been a lot of work that's been undertaken over the last year and a half. And the HRA have obviously been quite pivotal, I think, in actively speeding up research approval and delivery. And one of their programmes will be launching a sort of a rapid ethics review pilot for global clinical and phase 1 trials, which aims to halve the time to provide final opinion on research applications. And we saw that their turnaround in terms of the urgent public health COVID applications was extremely fast. So it does mean that actually, you know, with the right motivation, the right momentum, you know, we can do this in the UK. So the power of digital research platforms, again, you know, has been really clearly demonstrated during COVID. So HDR UK, Health Data Research UK, who fund NHS DigiTrials, and they undertook sort of a digital endeavour where they helped researchers report rapidly to studies such as recovery. Many of you will also have been aware of the UK Vaccines Registry that was UK-wide but led by NHS Digital, which allowed us to actually target people within the population that wanted to participate in vaccine trials very quickly. So we're now in a place where we're building on these successes, and we want to kind of increase the capacity of the digital platforms to improve the delivery of research. And we'll need to kind of review some of these initiatives and open them into a sort of non-COVID world, to help us address sort of other important population health burdens such as cancer and cardiovascular disease. And clearly this will obviously help us reduce the burden on frontline staff and support research delivery. For cutting edge treatments and technologies, including genomic medicines. So, never before, really, has innovative designs been more widespread and so necessary. So, Kieran talked about, the platform trials that have been really agile and adaptable in terms of testing new treatments really, really quickly. But, study teams across the UK have been adapting research delivery models to take advantage of the things we've needed to do during the COVID pandemic, and we need to be thinking more along these lines in terms of being more innovative, and there's, and across the commercial and non-commercial agenda. We know that innovative research should be easier for people to access, and also release capacity within the NHS. We've seen a number of studies, for instance, that have been done closer to the home and using sort of virtual delivery approaches, which would have traditionally really been done in hospital settings. And I think we really need to be thinking differently in order to sort of deliver the best research where it is absolutely best suited. And the next action is really something that Kieran has really kind of started to allude to, which is aligning our research programmes and processes to the needs of the UK health and care systems. So this is about looking to the future health needs of the population and to enable us to better understand the demands that will be placed on the population and the health service. We really do need to ensure that the research that's most needed to patients and the NHS across the UK is what we are absolutely delivering. So this has really been about being really clear about, the clinical research that we're delivering is really the research that's delivering the benefits to patients. And I think that is the real hook that's really going to get people in the NHS to really understand how the clinical research agenda does embed closely with practice. And again, Kieran talked about visibility, and this will be a key theme within the vision implementation plans, making research delivery sort of matter to the NHS. There's been lots of work, already ongoing. I know in Wales in particular, Kieran and I have spent the last 6 months speaking to the NHS organisations at the exec level and the R&D directors, and it's absolutely really clear that we are moving in the right direction in terms of making sure that, the research is up there at the forefront and is seen as essential and a rewarding part of effective patient care. So as part of the action plan, we will want to start looking at creating incentives and levers in the system to help staff feel empowered to support research. And this will also focus on, making sure we're collecting and reporting on the right sort of data to support that endeavour. And also, making sure that we're building research into healthcare regulator requirements for NHS bodies and possibly revalidation requirements, for doctors and other professions where possible. And again, COVID has demonstrated the need to engage diverse populations, and this obviously goes beyond the pandemic. Making research more diverse really is absolutely critical to addressing health inequalities. So we will be, focusing efforts in terms of how we actually go about doing this there's good practice. I've noted on the slide the Centre of Health in Leicester, where they have done lots of good work, and we probably will look at trying to take some learning and spread and scale that across the UK. Very important that where possible, the research has to be delivered where there are patients with the greatest need are located. And this will mean, increasing the capacity and the confidence to deliver research in areas with the highest healthcare burdens and levels of deprivation. So again, this is really about, research is for everyone. And last but importantly not least is really about strengthening public and patient and service user involvement. In the action plan, we'll be looking to expand the opportunities that we have to have sponsors easily access patient groups. Many of you will be very familiar with our Discover Your Role initiative, and we will be making sure that the aspirations within the vision is fed through to our Discover Your Role programme. So we, like everyone across the UK, can make sure that all the publicly funded research has the highest standards of public and patient and service user involvement, really in both delivery and design. And again, this is an area that we can't work on alone. We have to work in partnership with funders, which is absolutely key to improving, obviously, the diversity and engagement as well. So just before I finish, I just really wanted to quickly just mention that we will be part of a nationally managed approach to the recovery of multi-centre studies that's being put in place at the moment. There's guidance that's going to be out shortly. And there's lots of support for doing this from the industry stakeholder community in particular, but also from a range of non-commercial and charitable funders. We do know that we need to spend a bit of time focusing on recovering our portfolio. So we have been working with the NIHR Clinical Research Network, who's been having conversations on behalf of the UK with industry and non-commercial funders about choosing the most important studies that they want to restart and really kind of get over the line over the next year. So this will operate for a time-limited period so that we as a community can then target our resources and support these to happen. So this is an initiative, obviously, that Wales is definitely going to be supporting. But having said all of that, we've got great ambitions to make sure that we are ready to start as much research as possible. Many of you are, and I'm fully aware of that. And, under Mickey's leadership, we'll be looking at our capabilities to make sure that we do that and also start new research as well. So that's the link to the document. It's also on the Health and Care Research Wales website, and it's quite easy to find on Google, but I'm sure colleagues will be sharing the slide set as well. And to stick on the theme of saying thank you to everybody, I just wanted to end by saying on a personal note, thank you to you all. To use all the adjectives, it has been a unexpected and an extraordinary journey of the last year and a half. I've been really proud to be part of the research endeavour, and it's really shown what NHS R&D in Wales, but also the NHS colleagues that have supported the NHS endeavour, what you can actually really do. So again, like Nikki says, whether you've supported COVID research or the really important non-COVID research, I think you can safely say you've made a difference. So big thanks from me. Diolch I pawb.
Thank you, Carys. And we're about to go to a break, but before we do, I wanted to pick up on a question that had come in from Mandy during Kieran's talk, but very much Mandy Edwards, who's the CRUK lead nurse, and she had asked a question about embedding research and getting it embedded into the NHS, and you've touched on some of the UK vision aspects of that. But I suppose looking at Wales, Mandy's question was, we've long fought to make research a core value within the NHS, and have you got any ideas why that has been so challenging? Why have we not been able to break into the healthcare systems before now, whereas we have during COVID? And what do you think Wales can do now under the UK vision to really push that forward?
Yeah, it's a very good question, actually, because you could probably argue that, certainly myself and colleagues in the R&D division have been chomping away at this for a very long time. And I think, Mandy, you're absolutely right. You know, the COVID endeavour has been a real opportunity where we've really been able to talk about research, you know, at the highest levels, because it's had such massive impact. I mean, probably, you know, I'd be really interested almost to throw the question back, actually, because I'm really keen to hear from the community about their ideas in terms of what we can be doing next. You know, we can do a lot of pushing down from the top of government. You know, we've got research embedded in planning mandates. Conversations around research is at the highest level. Kieran and I were speaking to Andrew Goodall and his exec team this morning around research. And I think there is always so much we can do. And I think what the vision document is trying to signal is it is everybody's job to try and put research on the radar. And we need to possibly target not only the chief execs. I think every time I speak to a chief exec or a medical director, they're nodding enthusiastically. But we may need to target particular people within the NHS that may sit possibly between, you know, the exec teams and the people on the ground delivering research.
Well, Mandy's responded to your ask for ideas and feels that, you know, really important. I know we've talked about this very much before. You know, how do we embed it into training? How do we make it so that people expect to be involved in research, and doctors, nurses, AHPs, whoever comes through into the NHS, they're research active and research ready. So I know that's another piece of work that we'll hear about at other events. But good on you, Mandy, and other people. Please do put your ideas in or send direct, and because I think ideas from the ground is really useful to hear, as well as Carys suggested. So thank you very much, Carys.